You see some of our panelists over here. I'm going to call up three of our speakers from this morning, and I'm also going to introduce you to a fourth panelist. So if we can have Dr. Melissa Snider-Adler, Melissa Roth, Barb, Butler, please come on up here. And if you're able to take your seats. And while they're coming up here, I just want to take the opportunity to introduce you to our fourth panelist, and I'll also call him up as well, Peter Bartz. Peter is you've already met our three panelists prior, so I just want to have a bit of an introduction to Peter. Peter is the manager of the Toronto Transit Commission's Fitness for Duty program and has worked in the area of fitness for duty for nearly a decade now. In 2017, he oversaw the development and implementation of TTC's random testing program and continues to oversee its delivery. He works with the internal business units and with DriverCheck to administer the alcohol and drug testing, and is also responsible for training, consulting, and accommodations plans related to medication use and supporting fitness for duty investigations. So please join me in welcoming Peter and the rest of you panelists up here this afternoon. Okay, I'd like to frame this up a little bit. 1, 2. All right. I'd like to frame up the reason that we're here for this panel discussion is to talk a little bit about fitness for duty programs and figure out what that is, right? So we're all familiar with alcohol and drug policies. We've heard some limitations perhaps to how they can be used and what some of the pitfalls are. So we have our panelists who spoke earlier this morning to offer commentary on that, but since Peter is manager of a fitness for duty program in real life, I wanted to perhaps start with you, Peter. If you could just introduce us to what your program is at the TTC and how that came about, just to give us a framework for what that all is.
Sure. So the TTC's Fitness for Duty policy was brought in back in 2010 after a workplace tragedy that led to a review of our current drug and alcohol policy. And a number of gaps were identified that were kind of spoken about earlier today in what are the limitations of drug and alcohol policies. So we looked to take on a more comprehensive approach to workplace fitness for duty beyond just standards around drug and alcohol and testing. So we introduced this comprehensive policy that has fatigue management as part of that and medications as part of employees' obligations to report to work fit. They must responsibly use medications, and our policy requires that they disclose medications to the organization to receive advice on how to take those safely to be fit for duty and compatible with our testing program. In addition to that, the policy goes on to talk about standards related to drug and alcohol use, standards in the workplace for possession, including medications, as well as off-duty conduct that would affect the workplace. So things such as criminal charges or DUIs. So all of those standards and expectations are then supported through accountability and support in a drug and alcohol testing program where we have investigative tools for post-incident reasonable cause. We have pre-placement screening into our designated positions, and then we also have prevention and support programs that are administered through substance abuse professionals, oversight of return to work through our occupational health department, and then supported in the workplace in drug and alcohol testing.
Super. So a lot of the things that, Barb, you talked about, the elements of having sort of a robust program, and maybe I can go to you to tell us a little bit about maybe a historical context and how this all sort of came about or why this was also even necessary. But versus just having an alcohol and drug policy where we could just test and go from there.
So I might have mentioned earlier, but it started with the U.S. government's requirements for our cross-border truck and bus and potentially other transportation components, and their focus was testing. and their focus was on illicit drugs. And so in their regulations, there's nothing about prevention. It's just a focus on testing. And it was only drugs. And then one of the houses of Congress or whatever said, well, what about alcohol? And so they added that as an afterthought. So all this started where our cross-border folks had to comply with their regulations. But we looked at it from a Canadian point of view and said, well, wait a minute, there's more to this than just testing. And so we expanded the program, including for all the truck and bus companies. We expanded it to have a strong prevention component and to have a strong fitness for work component, and to make sure that if someone appeared unfit, the US regs would have them tested, reasonable cause, there you go. Whereas we felt that there could be a lot of reasons why someone may be unfit, and therefore there should be steps in the process, because it could be a medical condition, it could be extreme fatigue, it could be, an anxiety situation, and so we didn't want companies to just jump automatically to reasonable cause testing, and so that approach has been upheld in the various rulings. So our approach, as I said earlier, we can't just import a US policy because their approach is totally different than the Canadian approach, which is one of balance, and that's what we've got at the TTC.
Sure. I'll come back to you, Melissa Roth, in a second, but just wanted to let everyone sort of have a chance. If you have questions during the panelists, you don't have to wait for us. You can just put your hand up. We'll have our roving mics find you, so wave them down to ask the questions. But I'm curious, out of the audience members here, how many of you actually have more than just an alcohol and drug policy, like a fitness for duty policy? Did you see your hands? All right. So good, half of you. Do the rest of you just have alcohol and drug policies, standalones? Yeah? Okay, perhaps. Well, maybe I can just turn back to Melissa Roth then. So can you tell us a little bit about some of the considerations for having a fitness for duty policy versus just an alcohol and drug policy?
We touched on this a little bit earlier during my presentation, and one of the main things that that jumps out when I see drug and alcohol policies is that they talk about impairment. Inevitably, the drug and alcohol policies talk about impairment, talk about supervisors and managers determining impairment, and and my strategy has always been, let's not talk about impairment, because impairment is something that we are not necessarily qualified to determine. I mean, even drug and alcohol tests may not determine current impairment, or at least the most traditional ones. So why are we putting this burden on these managers, which when you're working together with the companies, you hear that the managers and the supervisors are complaining, and they're saying, why are you making me do this? I don't know if this person is impaired. How do I know? With alcohol, it's a little bit easier. Things started to change a little bit when the recreational use of cannabis was legalized, because then people started to question, are people impaired? Do I have to talk about impairment? Like, it was almost as if what had been happening for years before that had not been noticed. And now, because cannabis is legalized and the recreational use is legalized, all of these things are coming to the forefront. So I think that's a key aspect of it. The aspect of prevention is extremely important from an organizational perspective as well. But from a legal perspective, it's understanding that you cannot necessarily determine impairment. So when you're going to then terminate someone's employment because they were impaired in the workplace, and because let's say there are no human rights considerations, you might find yourself in a situation where you're failing in your defense against a wrongful dismissal lawsuit, because you don't have the ability to prove that impairment, right? So from that very raw legal perspective, there's a huge advantage to not talk about the traditional purely drug and alcohol impairment perspective and do it more in a fitness for duty approach.
I just need to add something.
Yeah, go ahead.
For anyone in this room that I've worked with, we've never used the term impairment in any of the policies. We have not, because for exactly that, we're determining, are they unfit for work? Is there a medical condition? Is there something that we need to address? Or at the end of the day, do we feel they may be under the influence of alcohol or other drugs? And if that's the case, we would look at a reasonable cause test. But the test, as you say, doesn't determine impairment. Like, it's just, you should not have any substance in your body at or above the cutoff levels, and that would be a policy violation. But we don't ever use the term impairment. We didn't with you, no, yeah.
Yeah, and Melissa, I mean, you get this question as well, so maybe some of your thoughts, your opening comments on
Yeah,
this.
I want to add to under the influence, just so that we can differentiate under the influence from impairment, because they are two different things, both. Well, I'm not going to speak from a legal perspective, but even in our legal format in policing, et cetera. But under the influence means that there are substances in your system that may impact your brain and your functioning. That's under the influence. So there's no need to say if you are under the influence that, oh, you have to prove impairment. They do not equal each other. So if your policy says under the influence, that means there are substances that are in your body that could be affecting your brain. And if they're affecting your brain, you're at risk of impairment, or you're at risk of having cognitive deficits or problems, et cetera. So I just wanted to point that out because it's really important. People use them synonymously and they think, oh, well, under the influence is the same as impairment, so I can say impairment. No. So, because we can prove that you may be under the influence, meaning that there are substances present. So I just wanted to sort of talk about that. And then, sorry, what was the next question?
I just wanted to know your opening thoughts on fitness for duty programs as well, compared to just having the alcohol and drug policy in place.
Yeah, perfect, thank you. So, you know, with respect to fitness for duty programs, I talk a lot about alcohol and drug testing, obviously, but as an addiction physician, my other huge part of this is to ensure that there's part of the program, A, that deals with people with substance use disorders, but B, knowing that drug and alcohol testing cannot always, it's not always the be-all and end-all. What do I mean by that? You have a reasonable suspicion. You have reason to believe that a person is not fit for duty. And I've had people say, well, I did a urine POCT, it was negative, so I returned them to work. Okay, let's take a step back here. You know, you determine that there's an issue here and you have concern about fitness for duty. Why is their test negative? A, because there's something else going on. B, because the test isn't picking up what it is that they are using. Or C, just didn't test positive for one reason or another. But again, we have to deal with fitness for duty, not just drug testing. Because if you thought there was issue for them before, unless that is now resolved, are they fit for duty? It doesn't matter what the drug test shows. Are they fit for duty? There was reason for you to believe that there was an issue. And so, you know, looking at the whole big picture is really, really important. It is not just about drug testing. It is not, prevention's another huge, huge part of it. But looking at the entire picture of whether they're fit. And there's maybe so many reasons. You know, we talked about sleep. We talked about anxiety, depression, chronic pain. I mean, there's so many, the list goes on and on and on, that you have to just really make that determination as a whole and look at it from a whole big piece and not just one piece of the puzzle, which alcohol and drug testing is a piece of the puzzle, but it is not the puzzle itself.
Yeah, and as any new parents will attest to, you can be quite impaired if you don't have a good night's sleep. You know, you have a baby waking you up. You get a drug test because somebody thinks that you're walking funny at work and it comes back negative. You should have a discussion as to what else might be causing you to behave this way.
So, Dr. David, that's why in all of the programs, if someone does the quick urine and does the alcohol test and they're both negative, but they were clearly unfit for work, they don't get back another, there's some kind of medical clearance, medical assessment, whatever. Like, they don't automatically go back to work because their test was negative. So again, it comes back to fitness for work. And okay, negative test, but what else is going on?
Yeah.
And in the training we do at the TTC, we talk a lot about the drug test is not the investigation. It is part of the investigation. The problem could be that they're off a medication that they need to be on. It could be that they're some sort of other underlying mental condition has surfaced and it could show signs of potential impairment. So it's just one piece of the puzzle, and don't return them to work right away. Reach out to Occ Health, EFAP, and all those other supports to finish your investigation before you're comfortable returning them to safety-sensitive work.
That's great. I want to go to a question over here and perhaps ask the audience to think about if you have a fitness for duty programs, what benefits have you seen? I wouldn't mind hearing some of your comments on that, but right there.
A lot of the conversation is around fit for duty for current employees or people who you've already hired. Where is really gray for us is on the pre-employment side. and where an impairment has been detected through a pre-employment assessment, whether it be drug and alcohol or medical, what are our obligations as an employer when we receive those results to proceed or step back?
That sounds like a legal question.
So there's a lot there. When it comes to candidates, when it comes to individuals who are applying for a position, whether we're doing, like even the law with respect to pre-employment testing is unsettled, because the reality is that what ends up happening with that is that, number one, you may be testing for something that is in the past, right? And that may not be necessarily something that affects them now. It may not, you may fall into a situation where anybody who tests positive is then considered to perceived as being disabled, right? And so now they deserve protection. There's some case law that says they deserve protection under the Human Rights Code. So you really have to ask yourself, what is the purpose of engaging in that determination of fitness for duty? Even if it's beyond just the traditional drug and alcohol testing, you have to ask yourself, what's the purpose of engaging in this determination? And what do we think we're actually going to determine with that? And is it going to help us for the whatever position that we're hiring for? And so the analysis will be very dependent on the circumstances. I'm not giving you a standard answer, because there's going to be no standard answer. But you're going to have to really ask yourself as an organization, what am I going to gain by determining pre-employment impairment? Because if we're talking about something that is transient, how is that going to test their ability to perform their job later? Right? So there's a lot in there from a legal perspective that I would say, do not necessarily think that this is something that will allow you to make a defense against not hiring that person. Yes.
Yeah. So, I mean, connected to this, Barb, you talked a little bit about the Elk Valley. This is not a pre-employment scenario, but you talked about the Elk Valley decision, where an existing worker had there was an accident and then was tested and found to be positive for cocaine. Post testing, went back and got a note saying that he had a cocaine addiction or a substance use problem. It went to the Supreme Court, and he was dismissed. It went to the Supreme Court, and the employer's decision was upheld to terminate. However, the dissenting opinion on that gave some cause for reflection. They said, hang on, if a person is actually impaired or does actually have a substance use disorder, it might be part of the disorder to not disclose it, to hide it, to shroud it. And although that decision went in favor of the employer, it gives us cause to think about this question for pre-employment testing. Does that have any sort of connection? Maybe throw it out to any one of you.
I think that one of the biggest learning points out of Elk Valley was that if you've got a strong prevention side to your policy, and the person had every opportunity to get help if they truly needed it, be it through confidential EFAP or reaching out to the company or whatever. The Alberta Court of Appeals said they had every opportunity to get help. They shouldn't be claiming a problem after the fact. The termination was upheld, and the Supreme Court said that wasn't unreasonable. Yes, there's always a dissenting opinion, but I go with the majority.
Yeah, as we all should. Yeah, but it just makes me think about, if a person is found to fail a drug test on pre-employment, they could go back to their doctor and say, you know what, I actually have a problem. I haven't disclosed this to you. Can you write me a note verifying that?
Yeah, and I think to your point, the policies need to have clear guidelines as to how we're going to report it, when we have to report it, and what are the consequences for not reporting it, right? And that's where some of the pitfalls of any policy, whether it's a drug and alcohol or a fitness for duty policy, comes, because there's no clear procedures, no clear guidelines, and then no clear consequences.
Okay.
And in this case, they said that the guidelines for getting help in advance were very, very clear. And the consequences for his actions was termination, and that was upheld.
The benefit of having a really well-structured policy. Yeah, okay, very good. So I'll go to this question over here.
2, 3, there we go. Quick question for Peter. I'm intrigued about the component about fatigue in the fit for duty. Melissa already talked about mental health and all the procedural portion. So alcohol and drug, but fatigue it's a little bit blurry. I don't know if we can expand a little bit more on that.
Sure. So when it comes to all the components of our policy, and I'll loop this back to fatigue, I mean, although I'm responsible for the FFD policy, I work closely with operations, OC health, safety, and all of those. So there's more of a holistic approach to managing fatigue. When it comes to seeing or observing fatigue, so we rely on observations of frontline management for fatigue as well as self-report for fatigue. And when we're faced with a situation where somebody's reporting fatigue, we talk about, I talk to management about, is this a pattern? Is it a credibility issue? And then get them safe transport home and connect them to resources where appropriate. If it's a pattern, then it can become disciplinary. They're not, showing up to work fit for duty on a regular basis, and it can be progressed to discipline from there. If there's a medical condition or potentially a medical condition, it would be referred to our occupational health department for follow-up on that and proper management of that condition. Does that answer your question, or is there follow-up?
No, it does. Thank you.
And just to add, I don't know if my mic is working.
Yeah, I'm not sure these mics are
But
not behaving.
Yeah, it's working, okay. So just to add to that as well, when we think about it from just distill the situation, when there's a pattern, of course, we either have to go to discipline or we're gonna go to, is there a duty to inquire into the accommodation process? But if, let's say somebody's grandmother was in the hospital and they spend the entire night at the hospital and they come to work and tell you that I spent the entire night at the hospital, there's an obligation on you as an employer at that point. The table has been turned. If this person has such bad judgment that they don't realize that they shouldn't have come to work and they're driving a subway, well, I as the employer now need to say, wait a second, you may not be fit for duty. And we ourselves invoke our own policy and we invoke our own procedure as opposed to the employee doing so.
Excellent point.
I'll just add one more thing. When we're conducting a reasonable cause investigation, we've come to many circumstances where an employee has offered fatigue as an explanation for their potentially impaired behavior. So we would then assess the credibility of that, but also maybe still continue with the reasonable cause test because that could just be offered as an explanation, trying to hide signs from something else.
Interesting. So we have another question from the floor here.
Yeah, so I deal quite a bit with the post-incident testing. That's primarily the service that we use with DriverCheck, as opposed to reasonable cause. Reasonable cause is pretty tenuous, especially in the construction industry, to approach that with somebody. But I have a difficult job explaining to the workforce the difference of, you don't want to get into the language of impairment, but the recreational, regular cannabis user in particular doesn't believe that after their 4-hour high that it affects them. It's much like they view it still as alcohol. You've been drunk, you get a hangover, I'm fine to go to work on Monday morning, where night after night, day after day of use through the documentation and science says that chronic use does impair the cognitive decision making of employees or individuals. So just asking for a suggestion on the best way to explain that to your workforce who don't believe that exists, and then we end up with a post-incident test and you're either in a suspension or a dismissal case, and they are staunch that I wasn't impaired or I wasn't under the influence so many hours after the consumption.
So I guess the question is on education. How would you go about doing that? Anybody?
Yeah, so I'll just, and that's the first thing that I was just going to say, is that the best thing to do, truthfully, to start off, and there were a few companies that had asked me to go and speak to the employees, just right around legalization. And I think it was a really great thing to do, in that I literally got up there and talked about cannabis and why cannabis is different than alcohol, and why you can have 2 or 3 drinks at 10 o'clock at night and wake up the next morning with 0 alcohol in your body and no effects. But that is not the same thing with cannabis. And so, with respect to explaining it to them, I would say the best thing to do is start off and explain it to everybody, not just in the post-incident, and really try to differentiate alcohol from cannabis. Because all I hear all the time is, well, they're both legal. What is the difference if I go home and smoke a joint, or if I go home and have a beer? And I say I understand legally that there is not a difference. They are both recreational drugs. But how they affect your body, how they affect your brain, and how they leave your system, it's like totally 2 different things. We are not talking about the same substances. And then you can kind of go on to explain, well, cannabis gets stored in the fat cells, and it gets stored in its active form, meaning it's not getting stored in the inactive metabolite or breakdown product. It is getting stored in the active drug. The active drug sits in those fat cells and goes from the fat cells into the blood, goes to the brain, and impacts the brain. Not in the same way as it does when you first are using and you have that high, so you're not going to necessarily have this massive surge, but there's enough there that has shown in studies that there are ongoing impairments. And the more complex the task, the more we see impairment. Just, as the last speaker was talking about, the more complex the task, the worse people tend to do, because sometimes with impairment, you can be fine until you have to do something very complex. And safety-sensitive work, it almost always involves much more complex or higher cognitive thinking, that sort of executive thinking tasks and skills that are necessary. So I think the big take-home thing here is, whether it's having lunch and learn, I know it's sometimes hard, lunch and learns, whether it's newsletters, whether it's whatever it is from an employee policy, employee education perspective, and however you can do that, your best thing is to start off with that. Let's just talk about differences in our 2 legal recreational drugs and why they're different. And that would be the first, in my thing, part of the Fitness for Duty, policy, so that there is education there and people understand the differences.
Yeah, excellent, thanks. Barb, anybody else want to take a crack on adding?
When all of this started changing with cannabis, and I went over the 1,000,000-mile mark with Air Canada, because I was flying nonstop, we did a cannabis Q&A, and we made it available to employers, but it's also in the online course that the corridor people are out explaining what their program is, and we made sure that it was part of the education, that we had a cannabis Q&A that just put it flat out exactly, what the deal is. Because there's a lot of confusion out there. It's just like alcohol.
Yeah.
Okay.
And another thing I say when I get questions like this from employees is, you've used cannabis, your euphoric high is kind of finishing, but you're returning to normal functioning still. And there's still an impairment from that, past that more residual impairment, where you're not back to your motor functions, your depth perception, your time, all of that functioning normally. And we're looking to, are you safe? Are you fit to be at work? So we need to measure not just your high, but also, can you perform safely? So it's that returning to normal, safe functioning.
And from a legal perspective, once you've done that educational component, as an employer, you have a lot more arguments to make when the employee says, but I didn't know, because you'll be surprised how magically no one knows anything once they get up on the stage.
It's true.
It's intriguing. But, if you have actually educated them and you have proof, make sure that you take attendance and that you take a signing sheet and you have proof. Oh, well, but you attended the session with Dr. Snider-Adler. Okay, and you still didn't know, right? And that's, I'm just going through the cross-examination questions right now, right? And it's like, well, I didn't believe it. All right, that's a different story, right? So education is key.
And keeping a record
Yeah.
of what you did.
And perhaps also not one and done. The memories are perishable, right? So we need to keep going back.
Yes.
You and I chatted about mental health communications, but in a similar vein. I'll come back to that in a second, but I think we have a question over here.
Yeah, just to build on this same discussion, Dr. Snider-Adler, you just kind of described that in the scenario where you've got a habitual user of cannabis who's using kind of on a daily basis in their private life, you know, that will likely stay in their system long enough to be detectable while they're on shift. I think the logical conclusion from that is that people who are regular recreational users of cannabis are essentially not employable in safety-sensitive positions, which is a really frightening outcome from my perspective. You know, if somebody's using in the evenings or on the weekends so consistently that they're basically self-medicating, you know, perhaps there are significant enough implications on their ability to do work that they should not be driving a commercial vehicle, they should not be working in construction. I'm curious, you know, what you believe the kind of broader impacts of that are on our ability to employ people who are cannabis users. Is it as simple as if you're a regular cannabis user, you should not be employed in a safety-sensitive position, full stop?
I promise this is not a seated question for your talk tomorrow, but maybe you can give us a preamble.
You know, it is a big conundrum, I will say, because you know, I've spoken to a number of people who said, look, there is absolutely no way I could do drug testing in our industry, whether it's truck driving, construction, whatever it may be, because literally I'd have to fire my entire workforce. You know, but I will tell you that a regular when I say regular cannabis user, I mean somebody that is using every single day and sometimes multiple times a day, and has been for 20 years, and there's a lot of people like that. I mean, you heard this morning when I said that like 26% of people that use cannabis in Canada are using it basically every day. That's a huge proportion of people that use cannabis. And we also know that the risks exceed the acute intoxication phase, meaning the risks in the workplace exceed the high, the period of time that you feel high. It is not a light switch. It doesn't go on and off. You don't stop feeling high and now light switch goes back on and everything is all good. It takes time, as Peter was saying. And so, yes, I agree that people that are using every single day, multiple times per day, or even large amounts at night or whatever it may be, are not fit for safety-sensitive work. It is the reality that you know, that every workplace is going to be free of anybody that uses that. That's not reality. That's just not what happens. And you know, even with pre-employment testing, people know how to pass a drug test, whether it's stopping using the drug and then starting it again. Like I had somebody who said to me the other day, well, I know that with this particular company, I can do another drug test in whatever it was, a couple months, et cetera. So I'm going to stop using now. But then the company told me that I can, you know, basically I can use, but just on my own time. This is what they're telling me. So it's like, so once I pass my drug test and I get higher, then I'll just keep using. Like, and that is the reality of what ends up happening. So it is a conundrum in that a good part of many workforces would be totally non-existent if we didn't have the people there, but yet there are a definite risk, 100%.
And that is why drug and alcohol testing is so highly regulated by case law, right? And that's why judges are so reluctant to uphold certain forms of drug and alcohol testing, such as random alcohol testing or drug and alcohol testing, right? Because that's what happened in Irving in 2013 when the Supreme Court of Canada decided that, you know, over a period of 15 years, there had been 8 instances of consumption of alcohol in the premises, right? And let's leave aside the fact that they didn't differentiate between drug and alcohol, but at the end of the day, judges are very reluctant to allow employers to make those kinds of decisions where we would end up with, you know, a very large portion of the population being either unemployable or unable to employ them in certain positions. Safety sensitive is a different story, but at the same time, there's no just a complete carte blanche in testing, right? There's still a lot of hurdles that employers have to go through.
Yeah, I know at DriverCheck, our occupational health department sees a lot of these questions come through, and our position is just that. If you are taking cannabis on a daily basis, effectively it makes you unfit. That being said, we take every case on its own merit, to your point. It's not a carte blanche. We actually have to go through the process to investigate this properly to get the right medical information, but oftentimes the conclusion is supported that for safety-sensitive work, if you're a daily user, we can't clear to be fit. This also parallels, I'll come back to you, this also parallels a similar situation with truckers using opioids. You know, the information from organizations that hire truckers say that if we restrict individuals who are using opioids on a daily basis from work, we won't have anyone to drive our trucks. And we have very clear guidelines on opioid use and safety-sensitive fitness, which, spoiler is, if you're on any opioids, you're not fit to be in a safety-sensitive role. But how many people, how many organizations still employ individuals on opioids, legitimately prescribed, in a safety-sensitive role? Right. I'll come back to you. Shauna, I think you had a question over here first.
So there's been a lot of talk.
There's a mic coming to you. I'll come to, and then, okay.
So there's been a lot of talk about drug and alcohol policy as it relates to safety-sensitive work, but I'm just curious as to policy as it relates to non-safety sensitive work, knowing the impact of alcohol and drugs on cognition, and if you have key stakeholders who are in positions to make very important decisions organizationally, so attention, memory, decision-making being affected by that. So I'm just wondering how all of this ties into the non-safety sensitive world.
So I can take that one. So our policy applies to all employees. So whether they're safety sensitive or specified management, designated executive or not. So that we have this non-designated section of the workforce. Everything applies to them except the drug and alcohol testing. So they wouldn't be subject to random post-incident or reasonable cause testing, but they still, if there's signs of unfitness, we'd still investigate. If there's a disability, they would still have to participate in testing as a part of a program for their recovery. So they're still required to disclose those impairing medications, receive advice, and be fit for duty. That requirement exists for everyone. Just certain accountability measures like random testing don't apply to them because they're not in a safety-sensitive role.
Yeah, and that's a good question. I mean, you can think of a couple of examples, like a software engineer who is working remotely and is responsible for the cybersecurity wall of a large organization. If they're impaired, perhaps they don't work properly and they open up a big gap for that, for the protection of their, think of a bank perhaps, or even a CFO for a large company who's handling the finances. What happens if they're impaired and what are the consequences? Yeah.
So the vast majority of companies that I've worked with over the decades, we've applied the policy across the board, and reasonable cause and post-incident still apply. If they've contributed to an incident by their failure to do the right thing, it still applies. This safety-sensitive part started with CN. I don't know if anyone's here from CN, but where we had an arbitration, and arbitrator Pichet upheld the policy, but said he was limiting the testing to risk-sensitive positions. And so that kind of was the trend to start, to limit it to risk or safety-sensitive positions. And then I had a union member with one of the utilities, the president of the union, say, why shouldn't everybody be held to the same standard? And I said, thank you, yes, that makes sense. So the policies apply to everybody. Everyone needs to be fit for work. There's investigative tools that can be used. And for most companies, the limitation is applicant testing limited to safety sensitive because of a major ruling here in Ontario at the Court of Appeal, and random would be limited to safety sensitive as well. And most companies here don't have random testing at this point in time because of the Supreme Court's challenge to prove a problem or evidence of a problem. But for the most part, the policies are just across the board. If the rules are this, then the rules apply to everybody.
Sure. Okay, thanks. Go to a question over here.
I'm wondering what the best practices are for follow-up testing for employees who have declared a dependency and have gone through treatment programs number of tests that should be administered as a follow-up program, the duration of how long they should be on that return to work program, and should the test be front-loaded, understanding the likelihood of relapse for dependents.
I wish we had an addiction medicine special. Oh,
Paul Gardner here in the room, and Paul does a lot of SAP work, and my understanding is they make the recommendation on how long the testing should be done and how frequently it should be, and that DriverCheck would then do a random date selection for that individual so they don't know a day or two in advance that they're going to be tested. Where's Paul? You got anything to add?
For DOT, it's 6 tests in the first year, and it's not spelled out when it would happen over that first year. That's the minimum. The testing can go up to 5 years.
yeah.
Okay, so you would look at each situation as to what would be appropriate for that individual, because we want to prevent relapse. Like, we want to support them on a going forward basis. Good.
Generally, it's about 2 years. I will tell you that when I've had to give recommendations of people who have had multiple relapses, so for example, they'll finish their 2 years, everything is fine, and there is some benefit, I was talking about this before, to follow up what I call contingency management. That's what we call in the medical term. So you have a person with substance use disorder, and their job is very, very important to them, and they know that they're going to be tested at any time. That helps it's like another motivation not to use any substances. It doesn't, obviously people do relapse even when they're being tested, and they know they're being tested, but it decreases that risk. And then sometimes at the end of that period of time, that just kind of falls off. And so when you've had these sort of multiple times, we sometimes will extend it. Sometimes what happens is the recommendation may be, at the beginning to do more frequent in the first year, less frequent in the second year, and to taper that off. Again, always done on a randomly selected time frame so that they don't know when it's going to be. But the more throughout the year, the more likely they are to know that they're going to be tested at any point. So if it's only a couple in the year, you can sort of see that one may think, oh, I just had my test. The chance of having another one now is going to be a little bit less, and that may increase the likelihood of relapse. So, as much as we see, in some ways, some people may say follow-up testing is a bit, maybe you're not being fair to the employee, et cetera. Most of my patients in my addiction clinic will tell me that they actually, they know that they're going to do well when they have that ongoing, and that at the root of it, they actually don't mind it. I had one employee who begged their company to continue the follow-up testing because he was so worried he was going to relapse at the end of it, because it was what was keeping him intact. And they said, no, we can't, just because the union and everything else, and he did end up relapsing. But anyway, we sort of think of it sometimes punitively, but it shouldn't be. Sometimes it is something that is very helpful for the employee just in their recovery and in maintaining recovery and keeping it top of mind. So, but generally it's 2 years, 6 to 12 tests per year. I would say, Paul, 6 to 12, is that generally?
Yeah, absolutely.
Yeah.
And more, the characterization is a dependency.
Yeah.
And to try to give more accountability for that person.
Yeah.
Yeah, so a great resource to have a substance abuse professional, thank you, Paul, for commenting, to have a substance abuse professional do an assessment and give you some of that information. And I think, I'm glad I heard you say a return to work agreement rather than a last chance agreement, right?
Return to work.
It's got to be a return to work, right? Maybe you can talk about this, Melissa? Return to work versus last chance.
It's certainly a lot more positive to talk about a return to work agreement, right? Like, there are only certain circumstances, especially in a unionized work environment, where a last chance agreement would play a role. The concept is still borrowed in the non-union world, and we still put in place things like that, but return to work agreement is certainly
But I guess, when talking about somebody who might have a substance use disorder or is returning back to work after some medical treatment, it would just feel wrong to move to an employment action rather than an accommodation.
There are different things, right? Like, the concept of a last chance agreement will be applied when basically the idea of a last chance agreement is you've been terminated. We would have had the ability to terminate you, Now we are going to instead issue this last chance agreement. You need to have their agreement to put it in place. Whereas a return to work agreement can happen after, you know, any period of absence as a result of an accommodation, and it may have nothing to do with an end of employment type situation. Because either it's not appropriate or, you know, it was never on the table to end the employment, right?
Right. I'm going to come back to Peter for benefits in a second, right after this question from.
Yes, hi. Just had a question on regular users. I did have an individual that tested positive, and he had indicated to me prior to going to the test he was going to test positive. He's been authorized for sleep disorders, and he does work in a safety-sensitive environment. I think it's still a gray area, and we determined we would hire based on the fact that he had, you know, 15, 20 years of experience with no accidents. He's cognitively okay, he feels, and we have seen that in his record from previous employers. What's your perspective on that? Like, I think we had a discussion with DriverCheck on that, and it was one of those gray areas. It's hard to determine whether we decline the candidate or not.
Okay, so.
I can guess what we told you to do. But
what was that?
I said I can guess what we told you to do.
Yeah, so, you know, here's the thing. Whether it's opioids, benzodiazepines, and we'll talk more about that tomorrow, but, you know, any kind of medication or cannabis for medical purposes that somebody is using on a daily basis, if you said to them, do you feel fine? Are you safe to do your job? Doesn't matter what they're taking. I guarantee they all say yes, because that is their true feeling. Yes, I feel fine. I feel fine with my opiates. I feel fine with my benzos. I feel fine with my list of 45 medications, all of which are impairing. And I feel fine with my medical cannabis. There is really good evidence to support the fact that for the most part is not true. That we can't rely on people's own perception of how they're doing, and with any medication. So I'm not differentiating cannabis from any other medication, because the truth is that sometimes when you are living in a bit of an impaired state, you don't see the difference in how you function than when you were off of that medication, substance, et cetera. And so relying on an individual to tell you that they are fine is very challenging, and I would say that it does put them at risk. I hear what you're saying, that this is what he's been doing for a long time and has not had any incidents or accidents, but you know, I've had lots of people that tell me that they drove drunk for 10 years before they had a massive accident and killed somebody. Yeah. That does not mean that they now are, you know, more drunk than they were. It's just that, you know, they were lucky.
But it would be dependent on the levels of which they're taking too, right?
Yeah, so when it comes to impairment from anti-medications, and cannabis being one of that, if it's being used for medical reasons, it is very much dependent on what they're taking, how much they're taking, when they're taking it, route of administration. You know, there's 45 different factors. If they're on other medications as well, because if they're on other impairing medications, that's just going to add to it. It compounds it. That's when 1 + 1 does not equal 2. 1 + 1 probably equals 4 or 10, meaning, you know, a couple different additives of different impairing medications is very problematic. So there are many, many things, and relying on the fact that they haven't yet had an incident or an accident does not mean that they are not going to have one. So I don't know if I've answered the question or just more commented on it, but
I think it's a tricky answer to say that you're going to clear somebody who's been on medical cannabis or on cannabis because they don't feel that they're impaired and their doctor doesn't feel that. By the way, if you ask treating physicians whether they think their patients are impaired for a job, you'll probably get most of them to say they're not. They're the wrong people to be asking because they can't also appreciate the degree of impairment. They're not doing any testing, so they don't have a way to know that. So it'd be very, very, I would say it'd be a very rare occurrence for us at DriverCheck in our occupational health department if we came across this to clear a person to say that they're fit for safety-sensitive work. There's no way that I'd be able to sit in front of a judge to say, dear judge, we cleared this person for doing this, and I know this accident happened, and can you disentangle the fact that they were on a known impairing medication from clearing them for fitness? We just wouldn't be able to do that. At the risk of, okay, 2 more questions. I want to get back to Peter because he's going to tell us the benefits of having a fitness for duty program. So,
specifically about cannabis cutoff levels, we've heard a lot of different levels
So again, testing, no matter what you're doing, whether it's oral fluid or urine testing, gives you a time frame of detection. And so what does the literature say about the time frame of detection is really what we need to look at, because it doesn't necessarily equate, what cutoff we should be using. It's more about when a person can be safe after the use of a substance like cannabis. And so again, it very much depends on the company's risk tolerance for various reasons. And a number of different things are often taken into consideration why people do urine testing or do oral fluid testing or use a cutoff of 10 or use a cutoff of 2 or 5. Sometimes it's regulations. Sometimes it's agreed upon with unions. Sometimes it is best practices. Sometimes it's we're going to go with what OMAC says with the 24 hours, so we're going to use a cutoff of 2 in the oral fluid. And sometimes there's various other reasons why one may use 10 or 2. So from a literature perspective, we have really good evidence that impairment exceeds that first number of hours. Very, very, very good evidence to support that now. We have very good evidence to support the fact that regular chronic heavy users of cannabis can be impaired for up to 28 days or even longer. And so it's just a matter of where you're going to balance out that risk when you're choosing the cutoff level. And sometimes it also comes down to, truthfully, what the arbitration decisions are saying with what they are accepting as cutoff levels that they feel would indicate the highest risk. So I probably didn't fully answer it, but those are the things that we need to take.
Just a point of clarification, though, 15 nanograms is the lab urine cutoff. The 2 nanograms, 4 and 2, and the 10 and 10, 10 and 5, those are oral fluid cutoffs.
Yeah.
Right?
Yeah, and we can't equate, they're totally 2 different things.
Yeah.
So, yeah.
And you touched on the arbitration piece. Is there any jurisprudence that would give us any kind of guidance on that as well, too, either Melissa or Barb, maybe thoughts?
No.
I mean, I'm involved in a lot of arbitrations, and it is very dependent on the actual specifics of the case and the specifics of the company, the specifics of the policy. And so there's probably a bit more acceptance from arbitration decisions for oral fluid versus urine. I don't want to say that that means that you cannot do any urine testing, so please don't take me to mean that at all, because there are a number of cases in a number of industries where across the board urine testing is done, and that's what they use, that's what they do. They don't want anybody using any substances really at all, essentially, because the risk can be there. So but when you look at a whole at those arbitration decisions, not to say that they don't accept urine, but there's a bit more lean towards oral fluid testing.
And that's all part of what arbitrators say in all of these cases is it's the balancing of interest approach, right? And that's when all of these different things that Melissa was talking about would come into play, right? Including the method that we're using and the invasion and the privacy of the individual, and hence the balancing of interest versus of oral versus urine and all of that.
Yeah. It's public, is there interest from the public perspective? Is it, what I mean? What are the risks of that particular workplace? And we can imagine in safety sensitive, it's all very different. I mean, whether it's mining, whether it's transportation, whether it's, driving a subway or driving a train, conducting a train. I mean, there's, flammable substances, like there's all these things that you have to take into consideration, and certainly the decisions do. So I don't want to say that from my knowledge and what I've been involved in that you should all be doing this because that's going to stand up, because it's very dependent on all the facts.
Okay, quickly to one last question, and then we come back to you, Peter. I want you to have the last word on that.
Thanks. We've touched a few times on narcotic use in safety-sensitive work environments, and I'm coming from the mining industry, and my question is around physicians that insist that their patient is stable. Are there independent medicals that can take place Does DriverCheck do independent medicals, or are there other experts that we can rely on to get an expert opinion on fitness for duty in a safety-sensitive work environment?
Yes.
Yeah, I guess the short answer is yes. So DriverCheck does not do independent medical examinations per se, but we've got at least one expert here who potentially can. We've got a number of, so one of the cautions that I will express is that treating physicians are really good at diagnostics and therapeutics. They're awesome at that. They diagnose and they treat their patients really well. What they don't do all that well is have an appreciation for the health and safety element as it applies to the workplace. And so there's at least a couple of arbitrations that have gone forward that have found where there's an occupational medicine physician who has opposed treating physician, say primary care physician's opinion on whether or not that patient or that worker was fit for duty. The arbitrator has found in favor of the occupational medicine physician's opinion because they tend to take a look at the health and safety aspect of that as well. So IMEs are as good as the IME provider, right, or the examiner. And maybe you've got a couple of points to say maybe then.
I'll just say really, really quickly, because we will be talking about this tomorrow, so come back tomorrow morning for my talk in the morning. I will, because that is really what we're going to be talking about, but I will just quickly say and add to it that physicians who are treating their patients are advocates for the patients, and they do not have, we don't learn in medical school about workplace safety. We don't know what that means. Like honestly, I'm telling you, until I started doing work in this field, I had no understanding of what actually safety sensitive was, or when my patient tells me that he does X, Y, or Z, I didn't really know what that was, because I just don't have an understanding or knowledge. Like, do I know the risks in mine as a physician? I mean, I do, but I'm just saying as a, from medical school, no, we don't learn these things. And so relying on a physician who is the patient advocate essentially to tell you that they're fit and they're fine when they have no background knowledge or information on occupational health and safety, occupational medicine, it is very challenging. And I know that it is where we tell people to go from a first step perspective, but it's very, it would be very few physicians who would say actually they're not fit because of their medication, knowing the, whatever regulations that we're dealing with or the, position of his job or her job. So anyways, but we'll talk about that tomorrow.
And just very quickly from a practical perspective, before you get into the huge problem and huge Pandora's box that is an IME, because if you have a union, you're going to get the union fighting that you have no grounds to request an IME. You're going to pay tens of thousands of dollars for an IME. Your first step should be writing back to the family physician with a letter with clear indication of what your questions are. And I'll give you an anecdote to illustrate this. Person who drives a tow motor. Family physician said they're cannabis users and they're fine to drive the tow motor. So we asked a lot of questions back with specific questions, such with a space for them to answer them, right? Because you're not going to get an answer otherwise. And then the essential part of that letter included providing them a job description and letting them know the type of environment that they worked at. They work in a manufacturing setting where they're working with tow motors and there's people walking in front of them. The response back was, I was not the treating physician. I was not the physician who prescribed the medicinal cannabis. I cannot comment on this. I cannot comment on the safety of this individual. Please go to their, to the person that prescribed it. And then when we did that as our next step in the procedural duty to accommodate, then this request died down. And then we had to assess that person and go down, are they fit for duty? So before you get into an IME, write back and ask specific questions and describe the position and the environment.
Yeah, we see a number of these types of questions that come to DriverCheck, and we've assisted a number of clients in trying to get there. I'm going to hold you on that one question because I just want to finish up the session, and I want to give Peter an opportunity to talk a little bit about some of the benefits of your Fitness for Duty program. You've been doing this now for a number of years. Please let us know how this is going.
Yeah, so organizationally, we've had the policy for 12 years. We've had random testing for 5 years. And we hear a lot about the challenges, the complexities of these policies, and how difficult and sometimes how expensive they can be to implement. But taking a step back, and having this experience the TTC has had for a long period of time, we are seeing a lot of benefits come from this program now, that it's changing our culture, and there's some ways we can measure that. So a key part of my job is employee education, engagement on the fitness for duty policy. So I jokingly say I'm on tour all the time across all the TTC properties, and I've really seen a shift in the last 5-6 years from questions like, why do I have to comply, to how do I comply? And very thoughtful questions on their personal circumstances, when they should go to their doctor, when they need to engage ALK Health. So we are really seeing a shift towards a much more proactive thought towards fitness for duty. And a lot of employees are, the next measure, the other big thing is we've seen employees now disclosing their medication to occupational health to receive direction on how to safely take that and how to work safely, and then that triggers some accommodations and stuff. But it's, we never really had that before, despite it being in our policy, and this culture shift has really made that part of the thought process for employees. This check-in before I come to work, this check-in when I'm being prescribed or taking something new, and I get a lot of calls saying, do I have to disclose this, and what's the number for ALK Health? So we're seeing this great shift in the mentality. Over time, we're also seeing our positivity rates, so our non-compliance, come down with our random testing program, and that's really great. And in addition to that, having these comprehensive programs allow you to have your finger on the pulse of what's going on from a fitness for duty perspective. And it'll be no surprise that that the TTC, like many other organizations and society generally, saw an uptick of substance use last year and since the pandemic started. So that really allowed us to see the extent of the problem in real time as we were receiving testing results, and we were able to then use that data to communicate, to reach out to employees, to put out information on where to receive support, and the need to disclose a substance use disorder if an employee suspects they may have one or does have one. So in addition, we did see an increased number of employees disclose their substance use disorders since the implementation of random and also throughout the pandemic. So it's been really great to have this in place in the organization and see the benefits of that as an HR department and from a safety perspective.
Awesome, and that seems like a great note to finish this off. Well-written policy supported by a really fulsome program that pays attention to the support of the employees, to communicate regularly, efficiently, to look at the accommodation, to consider other causes, not just drug and alcohol testing. That's how you get those awesome benefits. I know that I asked everyone to think about how this might benefit you if you have a fitness for duty policy. We've run out of time, and I don't want to stand in front of you before your break, but if you could take the opportunity on social media, on our LinkedIn page or on our Instagram, and just comment on what benefits you see. I think this one of the reasons that we're here is to share ideas and to share wins. And so if you can share that broadly, it may encourage somebody who's considering this to also take a look at that as well. So with that, I just want to thank all our panelists. Please join me in thanking them. It was such a great panel. Thank you very much. Dr. Melissa Snider-Adler, Melissa Roth, Peter Bartz, and Barb Butler. Thank you very much.